Hi there everyone, today in this video I am going to talk about Granisetron and Sancuso. So before moving forward, let me tell you that what will be the topics that I will discuss in this video. First is how to use Sancuso, and second I will tell you the use of Granisetron hydrochloride, or we can say Granisetron hydrochloride uses. And after that I will tell you the price of Granisetron in US market and also in Indian market. At the same time I will tell you whether we should use Granisetron before the food or after the food. And after that I will tell you the drug interaction of Granisetron, and again contraindication and the possible adverse drug reaction or the side effect of Granisetron. Lastly, you will come to know that I have covered following topic in this video. So let's just start the video. Okay, now I will tell you how to use Sancuso. First of all, we will move according to the steps. First step is to remove the patch from the carton, tear the pouch, open and remove the patch. Each patch contains one Sancuso patch stuck onto a rigid plastic film and a separate clear protective liner. Do not remove the Sancuso patch from the pouch until you are ready to use it. Do not cut the Sancuso patch into pieces. Second step is remove the thin clear protective liner to expose the printed side of the patch. Third, bend the patch in the middle and remove one half of the rigid plastic film. Be careful not to stick the patch to itself and avoid touching the sticky side of the patch. Step 4. While holding the remaining half of the rigid plastic film, apply the patch to the skin. Remove the second half of the rigid plastic film and press the whole patch firmly in place with your finger and smooth down. Press firmly, making sure it's stick well, especially around the edges. Once done, wash your hand right away after applying the patch to remove any medicine that might have stuck on your fingers. Keep the patch in place for the duration of chemotherapy. Remove the patch at least one day, that is 24 hours, after chemotherapy is finished. The patch can be worn up to 7 days. Depending on the number of days your chemotherapy treatment lasts. Do not reuse the Sancuso patch after you remove it. See instruction included with your Sancuso patch on how to remove and throw away after use. Okay, now I'm going to tell you about the Granisetron hydrochloride uses. First, you can use it for the treatment of nausea and vomiting, which is associated with cancer chemotherapy. In this case, an adult requires 1 to 2 mg of Granisetron within 1 hour before starting the chemotherapy, and after chemotherapy, 2 mg of Granisetron is administered daily in 1 or 2 divided dose during treatment. So now I am going to talk about children. In case of children, age ranging from 1 month to 12 years, only 20 mcg per kg of Granisetron is to be administered within 1 hour before starting the chemotherapy, and then 20 mcg per kg is administered 2 times in a day for up to 5 days during treatment. Note, all the doses are to be administered orally. Here I was talking about oral administration. Now there is a question, Granisetron should be taken with or without food. So I will tell you that Granisetron can be taken with or without food. At the same time, I will tell you the price of Granisetron in Indian market and US market. In Indian market, Granisetron costs not less than 28 rupees and not more than 164 rupees. While at the same time, when we are talking about the cost or the price of Granisetron in US market, at that time, its starting price is $17 and it goes to $65 approximately. Now I am going to talk about drug interaction. Phenobarbital may induce metabolism of Granisetron, and if the Granisetron metabolizes so fast, it will not work for a long time in our body. Now, contraindication, Granisetron is contraindicated in those people or those patients whoever shows hypersensitivity reaction toward Granisetron. In such case, we have to just avoid the use of Granisetron in such peoples. Now, adverse drug reaction or side effect. First is the development of seizure. Second, liver disorder, which is rare. Sensation of flushing, rash, dizziness, headache, constipation and chest pain. These are the side effect or the adverse drug reaction of Granisetron. Alright, here it's the end of video. I will just request you that if you are doctor, nurse, pharmacist or any other medical student, then kindly subscribe the channel, hit the bell icon and don't forget to like the video and share it with your friends. For now, bye bye.